renal cortex. But if I have a piece of tape here and I say name this structure, then that would be a renal pyramid. So I have 1, 2, 3, 4, 5, 6, 7 renal pyramids showing. Humans usually have 10 in each kidney. The other ones are in a different plane. But the space between the renal pyramids, like here and here, are the renal columns. The apex of the renal pyramid fits into this structure here, which is the minor calyx. Here's a minor calyx, here's a minor calyx. Where they come together is going to be the major calyx. This is going to be where the renal pelvis is. We have models that have much better renal pelvises. And then this is the ureter. So that's this case. We'll have to do this again when we do the blood vessels. So now this one's nice because I actually have a three-dimensional pyramid. Okay, we see the renal, the minor calyxes are very nicely done here. And again, where a minor calyx and a minor calyx come together, that's the major calyx. Here we have a cutout for the renal pelvis. So this is the renal pelvis. And again, pyramid, column, pyramid, column. Again, renal cortex. And the pyramids and the columns are in the renal medulla. Okay. This one is an oldie but goodie. Does have some nice arteries, which we'll go over again in the near future. We're going to see the pyramids and the columns, the minor calyxes, and where the two minor calyxes come together as a major calyx. Again, like the first model, it doesn't really have a nice renal pelvis, but does have a ureter. This is actually, this and this are related to the nephrons, and usually it's not on the test. Give me that last model. And here's the fourth one. This one has some nice blood vessels, and again, we'll do those blood vessels. So number 12 here, the card would have read, name this area. So that would be the renal cortex. And then if the tape was here and said name that area, this would be the renal medulla. We're seeing the pyramids, the minor calyxes. Can't really make out the major calyxes or the renal pelvis. And again, this is the ureter. Okay. So some models are better. This is really the nicest, but the other ones have some merit. And then for the reproductive models, these are we have two sets of these. These are really neat. All right. So for the female reproductive system, we have the ovary, which is here. This is called the filibree, which won't be on the test. But the filibree helps to direct the egg into this tube, which is the fallopian tube or the uterine tube. This is the uterus, and there are different parts. There's a fundus and a body, but you don't need to know that. Number 6 is going to be the very bottom of the uterus, which is the cervix. Now, in the cervix is a hole that isn't really labeled here, which is called the external os. And it will be in that hole that the sperm get in, and it will be out of that hole where the head of the baby comes out. And it starts out perfectly round, okay, about this big. And then when they say the woman is, 4 centimeters dilated, 8 centimeters dilated, what is happening is the uterus is contracting by kind of pulling up and then pushing down, a little bit like kneading bread. And as the uterus pulls back, it's ripping that external os open and then pushing down, trying to push the baby out. Postpartum, the external os will go back to its original size, but will never be perfectly round. And kind of like all irregular. So if they're doing, want to be CSI, so if they're doing an autopsy and the woman has a perfectly round external os, then she never had a vaginal birth. If it's all jagged, then they can't tell you how many vaginal births she's had, but she's had more than one. And then below the cervix and the external os would be the vaginal canal. This is the urinary bladder. This is the female urethra. This, even though it has nothing to do with the reproductive system, this is the rectum. And then this, the very end, is the anal canal. Some people get that mixed up. So rectum, anal canal. Now for the cervix, if I have an arrow like this and the card says name the opening, then you say external os. If the arrow is over here and it just says name the structure, then that would just be the cervix. Okay, so that's the difference. And then, thank you, the male reproductive system, the testes, where the sperm are made, this sitting on top of the testes is the epididymis, which is a temporary storage facility for the finished or matured sperm. When the male is undergoing sexual kind of climax, the entire male reproductive system undergoes a spasm, kind of peristaltic wave, starting with the epididymis and then pushing the sperm all the ways into the body. In the back of the scrotum, where the testes and the epididymis is the start of this tube, which is the, has two names actually. Clinically, we would call it the vas deferens. Academically, we would call it the ductus deferens. Cutting it is the old sterilization technique called vasectomy. Ectomy means cut. What are we cutting? We're cutting the vas. Now it's really, we think it's kind of easy. No, but the vas deferens is surrounded by nerves and blood vessels which are supplying the testes and the epididymis. So it's really not so easy to get just at the duct. You really have to take quite a close look. The vas deferens enters the male body through the inguinal canal. So we have a membrane here called the inguinal ligament. And people who have hernias, there's a defect. But right on the medial side, there's a canal coming out of the abdomen where my femoral artery would come out to go onto the surface of my thigh. Well, I'm going to use that same canal to bring the vas deferens into the body. The vas deferens goes up and over the urinary bladder to behind the urinary bladder, where we have number 5, which is the seminal vesicle. Now the male will release a liquid we call semen, which contains the sperm from the seminal vesicle. The seminal vesicle will add to the sperm sugar, fructose. Then we'll go through this small duct that comes into the prostate on an angle. That's called the ejaculatory duct. And then we're into this vertical part of the tube, which is the prostatic urethra. Surrounding the prostatic urethra, number 7 here, is the prostate gland. The prostate gland does 2 things. One is a valve, so that during sexual activity I shut off the blood, the urine flow. Now, sperm do not like acidity. The urine is usually acidic. So if I mix just a couple of drops of urine with the sperm, they'd all be dead before they got out. Okay, so we got to segregate the two. The prostate gland also releases a citrate solution, which helps to tune up the mitochondria in the midpiece of the sperm. So the semen now has citrate, fructose, and sperm, and then at the base or the root of the penis, there's this little tiny gland, number 8, which is the Copper's gland. And it produces an alkaline solution and a kind of a lubricant so that the sperm can get out the male penile urethra. Now, these tubes, like the fallopian tubes and even the urethra in the male penis, we sometimes think it's a tube, like a piece of rubber tubing, but it's actually a very complex tube that has lots and lots and lots and lots and lots of folds, so that sometimes those folds will develop calcifications, and therefore the sperm can get kind of hung up on some of those folds. Same thing with the fallopian tube. The egg can get hung up. It's not a straight, round tube. Okay, we don't know why we did that. The penis has the erectile tissue, which is kind of a spongy material that we fill with hot arterial blood. The base of the penis is actually adhered to the pubic bone. And then, of course, this number 30 is the male rectum, and 31 is the male anal canal. Okay, so those are the materials. These models, they will be a major, almost maybe 60% of the lab file. Okay, so the rest will be the pig, which we'll go back to next week. So you got the models, look them over, go over